Okay, this lecture is Journey to Better Health. This is part 3. I'm going to give you some quotes from some of the great Greek healers and philosophers. This guy right here is Hippocrates, and Hippocrates is a great Greek physician of ancient Greece. He said, "Illnesses do not come out of the blue. They are developed from small daily sins against nature. When enough sins have accumulated, the illnesses will suddenly appear." And it's like that famous quote, basically, most men, they dig their own grave with a fork and a knife. Okay. Okay, here's another one by Hippocrates. All disease begins in the gut, and that's actually much more true than is widely realized. All the patients, almost all of them, they have the same disease. They eat a high-fat, high-sodium diet, so they get high blood pressure, and they also get diabetes from that. That causes atherosclerosis, plugs up the arteries in the heart, in the Johnson, in the brain, and in a bunch of other locations. Because it's low in fiber, they get abdominal pressure syndrome. Hiatal hernia, where the stomach pops into the chest, gastroesophageal reflux disease, high-fat diet, so they get gallstones, atherosclerosis to the spine, so they get back pain, straining at abdominal pressure with constipation, so they get varicose veins in the leg, varicocele in the scrotum, decreased fertility, rectal hemorrhoids, periumbilical hernias, inguinal hernias. It's all the same stuff. I see it all day long, every day. Diverticulosis, diverticulitis, dry stool on the right, appendicitis. And then the same thing, lack of fiber causing abdominal pressure syndrome causes leaky gut, amyloid clots, increasing cerebrovascular decline, cognitive decline, cardiac decline, atrial fibrillation, congestive heart failure. Okay? It's all the same stuff. The vast majority of patients. Okay, that's why you've heard people like McDougall, T. Colin Campbell say dietary disease is about 80% of disease. Some people will say 70%, others will say 80%. McDougall used to say 80%. Okay, and it's gotten more complicated. They put so much crap in the food. Nowadays, there's basically toxins. You could call them poisons are in your food, so you got to be more careful about choosing your food. And it's just the way it is. Okay, so most disease, hardly any disease is genetic. And you never want to say something's genetic until absolutely certain, because once you say it's genetic, you're saying there's nothing you could do, and you've given up. You're just going to get drugged or surgerized. Okay, here's a good quote, Hippocrates. "Wherever the art of medicine is loved, there will also be a love of humanity." And I can assure you, the medical system does not love you. It considers you just a widget on an assembly line. Okay, and I've also said it before, you have to have Christian ethics or you can't have good medicine. In the modern Western conventional medical system, it does not have Christian ethics. It has gotten rid of Christian ethics. Christian ethics says Bible-based. You don't have to be a Christian, but you have to have Christian ethics, which says man is created in the image of God, therefore he's part divine, therefore we must treat him well. We must do right by him. We must make him our top consideration rather than money. Okay, and that has consequences. We respect his right to privacy, to free being able to speak, okay? And it means a lot because you almost always make a lot more money if you lie to the patient and you sell them stuff or you take advantage of them. So the modern system is based on atheistic Darwinism. A college professor, if he mentions intelligent design, he gets fired from his job, okay, for heresy. It is a religion, atheistic Darwinism, and it's put in place because power in the modern world means money, dinero, okay? Dinero is the ability to get people to do something else, okay? And in a sense, a female beauty is a little bit like money because it can get other people to do things, all right? But anyways, the point is that big money wants more power and control and the right to do whatever it wants, and it gets that with atheistic Darwinism. It doesn't get that with Christianity, okay? But you need to know that. That's why the parents are the two best people in the world for a child, because they love the child. And somebody else, all these pediatric psychiatrists giving these kids amphetamines for attention deficit, it's ridiculous. They're poisoning these children, okay? So that's what I'm trying to say is, if you love somebody, you would want to do the best you can to help them. If you were indifferent to them, if I walked up to the average man and child on the street and I said, "Would you poison the child?" They'd say no, okay? But a psychiatrist with an MD, pediatric psychiatrist, they would do it all day long. That's how they make a living. And that's what I'm saying is when you have an atheistic Darwinistic system, you end up with doctors who are happy to poison the patient to make money. They're happy to do it. And they can just hide behind it's a standard of care. Standard of care is to poison the patient, okay? And that's why I tell you as the citizen watching this video, you have to learn to educate yourself. Because if you go into the system blindly, that's what's going to happen to you too, some variation of that. Now, don't get me wrong, the system can do a lot of good things. It's very good for trauma. It's very good for acute illness. It's good for end-of-the-line illness, put you on a dialysis machine, give you a kidney transplant, give you an artificial hip, artificial knee. That all has a useful purpose. But most people have the same old problem. They eat a high-fat, high-sodium diet, and they plug up their arteries. Okay, that's what I see all day long, nonstop all day long. I've had days when 19 out of 20 patients I see have fatty liver, meaning diabetes. Okay, I can tell you, over 90% of the cognitive decline brains I see, the patient has diabetes and hypertension. Okay, and then 5% have one or the other. Okay, and the other 5% are rare things. All right, walking is man's best medicine. We're made to walk. Try to walk a lot if you can. That solves a lot of problems. Get your immune system to increase flow 10 to 30-fold. Let food be thy medicine. Eat the low-fat, low-sodium, 100% vegan diet, whole food only, single ingredient only, no oil, no alcohol, no caffeine, no tobacco. Moderation doesn't work. Every chump likes to say that to himself. I'm cutting down. Those people don't do well, okay, just so you know. I have all these guys that come to me and say, oh, their family member has diabetes or some other condition. Well, they're trying to cut down on meat. They're trying to cut down on oil. A year later, they're in kidney failure or they're going for major surgery, okay? They don't do well. So you don't want to be a typical half-assed, mediocre person. You want to say, I want to fix this problem. Everybody in Asia who eats rice is skinny. I'll eat some rice. The potato people, they're skinny. I'll eat potatoes. Okay, the sweet potato people, they're skinny. I'll eat sweet potatoes. The blue zones, they often eat a little beans. Maybe I'll have some beans. All right? You can do pretty well with oatmeal. You can do pretty well with quinoa. Okay, here's another Hippocrates quote. If someone wishes for good health, they must first ask themselves if they are ready to do away with the reasons for their illness. Only then is it possible to help them. Yeah, like I said, I did a surgical internship. I'd consent patients, craniotomy, open heart surgery, you name it. They'd sign the consent in 2 seconds. You tell them to do a vegan diet. Oh, no, you're welcome to cut out a quarter of my brain. I have no problem with that, but I'm not going to eat a vegan diet. So it's like, you know, I'm in a hurry. Every doctor's under tremendous pressure to go fast. There's always some bean counter, money counter, okay, who wants them to go faster. So if they're trying to be nice to you and talk to you, they're doing you a favor. So listen to what they say. But most conventional doctors don't know anything about nutrition, epidemiology, or toxicology. But that's where you cure people. That's where almost all the cures come from. You can't cure a dietary disease with a pill. Okay, here's just a quick quote or so from Plato. Plato was one of the great Greek philosophers, and he sort of was a failed playwright, a failed politician, and then he started incorporating that style, though, into his writing of philosophy, making him into like a play, a dialogue with Socrates and other people. One scene here with Plato was he was asked to give a definition of a man, and he was trying to sound sophisticated. He said, a man is a featherless biped. And then Diogenes, who's sort of like the homeless street philosopher, he said, here is Plato's idea of a man. And he plucked a chicken, and he had the chicken run around in the room. You know, so it walks on 2 legs, it has no feathers. And a lot of people, that's pretty much what they're like, you know, bipedal chickens. Plato said that no one is more hated than he who tells the truth. And that's very much the case in academics, because you have a lot of big, powerful people making millions or billions of dollars off of lying to all the ignorant proles. They don't want the proles to know the truth. They won't make money off them, okay? So whenever somebody's telling you something to make money off you, be a little skeptical, okay? Okay, the reality is you're probably going to die from hypertension, diabetes, coronary artery, cerebral vascular disease, and cancer. And those things plugging up arteries to your brain, your eyes, your kidneys, etc. You're on your own. The medical system most of the time can't help you. So it's worth your while to learn this stuff, okay? Most Western doctors, they absolutely are total ignoramuses. All they know is drugs and surgery. So they can't help you with the chronic diseases, which are dietary diseases and toxicology diseases. Here's Plato's cave, where basically the ignorant masses, the proles, the chumps, the plebeians, they were always watching the shadows, just being gaslighted, okay? And told all this nonsense, like on all the bro science channels, the high-fat phony channels. Oh, you should eat soy. Fluoride is good for your teeth. Coffee is good for you. MSG is okay. You know, all this BS. Okay, and then, you know, to climb out of the cave, this is Plato's allegory of the cave, is to come and see things with the sunlight and to see objective truth. Just look around you. McDougall used to say you can see the truth. All these rice-eating Asians, they're skinny. The sweet potato-eating Papua New Guineas, they're all skinny. The South American potato eaters, they're skinny. The Irish potato eaters, they're skinny. And the people who are skinny, they, like in the Chinese too, they usually don't have autoimmune disease. They usually don't have hypertension. Now, I know there's modern exceptions to that. We're not going to get into diabetes type 1.5, not right now. This is an introductory lecture, but the point I'm making is, this is the best you can do. I've been a doctor over 30 years, I can tell you. Low fat, low sodium, vegan diet, 100% organic, okay, whole food, single ingredient only, no oil. That's what makes people healthy. You can take it or leave it. And go ahead and leave it. There's plenty of young junior doctors that would love to cut you open and sell you some drugs, okay? You know, it's your life. It doesn't affect me what you do. It basically comes down to you're like a car. You buy a car, you want it to last like 90 years. And you can buy a new car, you can't get a new body, and so you have to learn what type of gas to put in. If the car says put in premium gas, you got to put in premium gas. And premium gas for the humans, that low-fat vegan diet, I could care less about animal rights. I could care less about religious reasons for veganism. I care about health. It's the way to be healthy. I can tell you, this guy's the best doctor who ever lived. He cured more patients than anybody else, John McDougall. And here's what he says: the fat you eat is the fat you wear. The biggest toxin in the Western diet is the fat. All this good fat stuff is a bunch of nonsense. It's just a trick to sell the ignorant proles stuff, okay? They want to sell you omega-3s. They want to sell you olive oil. They want to sell you nuts. They want to sell you seeds. They want to sell you avocados. You don't need any of that stuff, okay? McDougall's book, The Start Solution, is sort of the best introductory book to give people a clue about nutrition. Okay, McDougall, he said, all large healthy populations since the beginning of recorded time have survived by eating a starch-based diet. The vast majority of their calories came from starch. That is the case. There are no exceptions to this. Over 99.9% of the people who've walked on the face of this earth have eaten a starch-based diet. There are no fruitarian societies. Now, don't get me wrong, I think fruits are a very good food. I eat a lot of fruits. But I'm just saying, starch is the widely available. It's cheaper than fruits. It stores better than fruits. It satisfies hunger. Okay, Asians are rice eaten for over 10,000 years. Okinawans eating sweet potatoes. Papua New Guinea eating sweet potatoes. The Mayan and Aztecs are the people of the corn. The Incas of South America ate potatoes and quinoa. The old ancient Egyptians ate wheat. In Africa, they also ate millet, sorghum. Okay, these keep populations healthy. McDougall would say the name of his book was Start Solution, and the purpose for that was people say, what can I do to improve my health? He'd say, eat starch. Starch is the solution to your problems. That's why the book is called Start Solution. Okay, and again, it's kind of like Super Mario Brothers, any video game. The character walks down the obstacle course, and if they do stupid stuff, they lose energy points. You know, they get the little red light going off, okay? That's like drinking, smoking, eating high-fat, high-sodium processed food. All right, you do the good stuff, you get little green energy points. And it's the same thing in life. You make yourself stronger and healthier, you make yourself weaker. And you can get away with being pretty stupid when you're 20 years old. You stay out all night and get drunk, and you might even be able to work the next day. You try doing that when you're 50. Good luck. Okay, the higher your LDL cholesterol, the thicker your blood. The thicker your blood, the higher the pressure it is to pump your blood to the top of your brain. That's why you have a blood pressure. Fat makes your red blood cells stick together. It's called blood sludge rouleau formation. By LDL cholesterol will do it, triglycerides will do it, chylomicrons will do it. IgM antibodies in acute infection, they'll stick your red cells together. Fibrinogen, the clotting protein, will stick your red cells together. You get leaky gut, it activates the fibrinogen, actually an amyloid formation where it changes its secondary protein structure and it becomes more prothrombotic, more prone to clotting. Okay, so leaky gut increases your clotting. Uric acid, like you get from eating lots of meat or from eating a lot of high fructose corn syrup, that also yields a bridging molecule, sticks your red cells together, making them more prone to clotting. In the real life, people die from clots. In the movies, people die from blood, okay, bleeding, you know, exciting drama in the movie. But in real life, clot in the artery is a heart attack, a clot in the brain is a stroke, and a bunch of little clots can cause atrial fibrillation, congestive heart failure, can cause blindness, hearing loss, back pain, all kinds of problems. You don't want that. Okay, sticking the red cells together by the bridging molecule, rouleau formation. Typical red blood cell, 7 microns. You want to know that number. Capillaries about 5 microns. So to push them through the capillaries becomes more difficult if they're stuck together. So you got to pump at a higher pressure. It's been shown all the way back in the 1950s. You eat saturated fat in the 1960s. They showed it also with PUFAs, polyunsaturated fats. Your red cells stick together. You decrease oxygen delivery to your tissues anywhere from 15 to 30%, depending on the context. and that can cause dysfunction in your cells, especially when there's already baseline atherosclerosis. This work was done by people like Peter Quo, the cardiologist in Pennsylvania in the 1950s, Meyer Friedman, Ray Rosenman, ophthalmologist in the 1960s. Okay, so here's the paper of Meyer Friedman with Ray Rosenman, and you can see their names up in here. Serum lipids and conjunctival circulation after fat ingestion. Okay, and here's the reference. You want to look it up for yourself. Friedman circulation, 1964. So they fed people high-fat meals, 67% of the calories from fat. They also fed them with bacon, so there was also sodium in there. And the arteries inside their eye, they were looking at their eyeballs with an 80-fold microscope, became severely vasoconstricted. That means narrowed. And they'd even see a transient loss of flow in some of the vessels. So everything in your body functions better with good blood supply. PO2, partial pressure oxygen, was dropped by 20%. Not good. So you take some old person, a baseline brain full of atherosclerosis from chronic hypertension and diabetes, you drop their PO2 by 20%, they might have a little miniature small stroke, or they're certainly predisposed to increase apoptosis, loss of brain cells gradually. I see that all day long, every day. And then all of a sudden they're stupid. They've lost their motivation, their ability to think, and they're never going to get better. Most people never get better. There's sort of this idea, oh, America has the best hospitals. BS, okay? We spend the most on healthcare in the United States, but we have very poor outcomes. We're about in the middle of the health outcomes all over the world. And that's why I jokingly have said, you can hang around with these backward, illiterate people that can't even write their name in these countries where they eat plant-based diets. They don't have hypertension, okay? But then you can go to the Ivy League American hospitals and the other major medical centers, and they can't cure hypertension. They don't know what causes it. All they want to do is sell you drugs that don't work. High blood pressure leads to increased systolic pressure. The high pressure blood hits against the median divider at all bifurcations. I'm just showing you the carotid. So your arm would be like your common carotid artery in your head. I'll make myself bigger to show you. You can just use, I call it the hand trick. That's how I teach people the carotid anatomy. Your hand is like, your thumb is the internal carotid. Stick that like up under your jaw. That goes to your brain. The 5 fingers go to your face. That's called the external carotid. The big artery coming up is the common carotid. Anyways, there's a median divider between the thumb, which is the internal carotid, and the external carotid and its branches. So here's external carotid ECA, internal carotid ICA. The high pressure blood hits the median divider and bounces off of that. And then you have turbulent flow. Turbulent flow means chaotic flow. And you get some slow retrograde eddy currents. That confuses your endothelial cells. Your endothelial cells are the lining cells on the artery. When they see all this turbulent flow and excessive retrograde flow, it's called eddy currents, they think that there's an injury to the vessel. They shed their antithrombotic glycocalyx. Those are the glycoproteins on their surface, and they now have expressed beneath them adhesive molecules, things like VCAM, vascular cell adhesion molecule. Because the glycocalyx is high, it's like 600 nanometers in height, whereas these VCAMs and whatnot, they're only about 60 nanometers in height. So once the glycocalyx is out of the way, the heparin sulfates and whatnot, sialic acids, now you're just sitting there with those VCAMs, and the cells will bind to them. You'll start forming clots. And that's where I always see it, on the side away from the bifurcation. I see that in the internal carotid artery. Every day I look at angiograms of the brain, and I'll see that every single day. Okay, and the same thing is happening. There's far more bifurcations on your heart than there are, in your carotid. So you get tons more atherosclerosis in all these little branches of your heart. And this next little drawing here is going to show you what it looks like. Okay, so here's the drawing, and you get the plaque always starts just opposite the bifurcation. Okay, and atherosclerosis is a blood clot. You need to know that. Your doctor is not going to know that. The way doctors are taught atherosclerosis is a total joke. It's stupid. They're just told cholesterol is bad. Okay, well, why is it bad? It's bad because it causes blood clots. And like I said, I've looked at many thousands of these things. You can't tell a blood clot apart from an atherosclerotic plaque on a CT angiogram of the neck, of the chest, of the abdomen, anywhere, because they're the same thing. Okay. A thing cannot be and not be itself. Okay, so like I said, the whole thing reminds me of Dante's Divine Comedy, when Dante met with Virgil, the great poet of the Romans who wrote the Aeneid, and they go before the gates of hell, and right on the top of the gates of hell is a sign, "Abandon hope, all ye who enter." The chronic diseases, diabetes, hypertension, coronary artery disease, they're all called chronic diseases because conventional medicine can't cure them. Low-fat vegan diet cures that stuff all the time, the vast majority of patients. Okay? So, what a joke. Conventional medicine is the standard, the gold standard of care, of healthcare. Okay, and it confesses to you up front that it can never cure the common diseases, never. But vegan diet cures them like that. It's a walk in the park for vegan diet to cure them. So why is the other thing the standard of care? Somebody has coronary artery disease, okay? The cure rate for pills is 0%. The cure rate for stents is 0%. The cure rate for open heart surgery is 0%. The cure rate for low-fat vegan diet with no oil, Esselstyn diet, is 100%. So why would anybody want to take a treatment that never cures a patient? Never. Zero. But that's what 99.999% of people do. Okay? That's also why you have all these phony trolls on the internet, saying bad things about the vegan diet, because big pharma, big medicine, they don't want the public to know about this. If the public knew about this, they wouldn't go to doctors. I'm 61 years old, okay? I'm 61. I don't have any medical problems. I don't take any pills. So this is what you want. You want to try to be healthy. You want to try to not have to take pills. You want to try to not have to go to surgery. And I can tell you, this is the only way to do it. I don't make any money from this. I'm just telling you the truth. I'm an egomaniac. I want to be the best doctor in the world. So I have to tell you the truth. I'm also a Christian. I got to tell you the truth. And that's the truth. You could take it or leave it. Okay, I realize most people are too stupid. They don't get it. But at least you gave them a chance. Okay? Like I said, there are lots of doctors happy to sell you drugs and to cut you open. They would like nothing more than to cut you open. They're going to take a rotating circular buzzsaw and cut your sternum here. They're going to crack your chest, spread it with retractors. They're going to go down on top of your heart. They're going to take the left internal mammary artery. They're going to drop it down to your left anterior descending artery. It's called a lima to the LAD. My father had that. He came out of surgery okay for 4 years. He was okay. But then he had a stroke afterwards. And he dissected his vertebral artery. And I think it's because it was stapled to the LAD. And it couldn't move when he was shoveling snow. The snow was wet, sticks to the shovel, staccatic motion. And he injured that artery, had a stroke, okay? And I see a lot of people get cognitive decline from cabbage, okay? This cabbage means coronary artery bypass graft. Okay, here's a typical cabbage. Here's your lima to the LAD, left internal mammary artery to the left anterior descending coronary artery, okay? Actually, this is more of a better picture of a lima to the LAD here. Anyways, you can call it a single bypass to one vessel, double bypass to a second vessel, triple bypass, quadruple bypass, whatever. But you still can't fix all the little arteries. I'm trying to find a spot to put myself. There's a ton of little arteries on your heart everywhere. You can't bypass the little ones. You can't bypass intramyocardial ones. And you're only going to bypass the large fixed stenoses that you can see on cardiac cath, CT angiogram. You can't bypass the smaller ones, the ones that actually have soft plaque and are more likely to rupture and cause a heart attack. So this does not lower your risk of a subsequent heart attack, all right? And I've seen these channels where there's YouTube channels where you'll see cardiac surgeons talking to paleo-keto carnivores, and I watch those videos and I'm just amazed. They say one thing after another that's wrong and it is not true and it hurts patients. And they'll have hundreds of thousands or millions of views, okay? I sit here on my little channel, I tell you the truth. And by the way, I did a fellowship in vascular with an emphasis on treating vascular disease, vascular interventional, imaging-guided surgery, interventional radiology at Harvard, okay? I'm quite familiar with, I've written multiple book chapters on atherosclerosis. I can tell you, this paleo-keto carnivore diet is nonsense. It's going to plug up people's artery and cause a lot of sickness and death. And I can also tell you open heart surgery is not going to make you live longer for treatment of standard cardiac angina. The most common reason it's done with coronary artery stenosis in the epicardial coronaries, the big arteries on the outer surface of the heart. Okay. There's a few special circumstances where it has a little bit of benefit, but it's one of the most overrated things in medicine. But it pays $150,000. Hospitals love it. Stents pay $30,000 a piece. Hospitals love it. Their opinion of this stupid vegan diet that doesn't pay anything, or you're lucky to get $1,000 or $2,000, you bring the patient in for an educational seminar. You can imagine why, if you were a hospital administrator, you would hate the low-fat vegan diet. You don't want the patients to know that they could cure themselves easily at home and not have to come in for these big surgeries. That's why I jokingly call the 5 wounds of cardiac surgery. You're going to get a cardiac cath from the right groin. You're going to have a sheath put into the femoral artery and the femoral vein. Okay, they're going to come up into the heart. They're going to do a right heart cath quite often. They're going to cath the coronary arteries. Then you're going to go for surgery. They're going to put a right internal jugular vein swan for the anesthesiologist to monitor your pulmonary artery pressure intraoperatively. They're going to end up post-operatively putting in a mediastinal drainage tube and a chest tube in the pleural space on the left side, okay? And then you're going to get, like I said, a rotating a rotating saw is going to cut open your sternum. Okay, so those are the 5 wounds, like the 5 wounds of Christ. These are the 5 wounds, I call them, of the village idiot, getting a surgery which they could have cured themselves easily by eating a plant-based diet. I say, I'm not scared of eating a salad, but I would be scared of going on this table because a lot of people have problems when they come off of that, okay? All you got to do is follow Esselstyn's diet, walk in the park. Dr. Caldwell Esselstyn says that he's never seen a single patient have a cardiovascular event if they actually followed his diet. And he pretty much only teaches one simple thing. He's a surgeon. Surgeons, tend to be very results orientated. They don't tend to be that intellectual. Okay, and he basically says, look, if you eat this diet, you'll maintain nitric oxide, the most important vasodilator in the body. That's what keeps your arteries open. It's a gas. It diffuses into the blood, inhibits the platelets from clotting, so it prevents clotting. It's a gas. It diffuses into the wall of the artery, the smooth muscles, and prevents them from contracting, so it opens up the arteries, causes vasodilation. That's all you need to know. Like I said, I went to his course and I kept asking the question, what about this? What about this? And he goes, I'll talk to you later. I'll talk to you later. He just wanted me to shut up. And he came by and he talked to me later and he said to me, Pete, these patients, I have to keep it simple for them. I just teach them how to protect their nitric oxide. If they protect their nitric oxide, that's like their life jacket, their safety preservers. They'll be okay. They'll get a great result. That's all I care about is how they get a good result. He says, if I told them about all this other stuff, I would confuse them and they would forget everything. And he's right. So the important thing is you keep that artery open. It doesn't matter if you know the 5 different mechanisms or something. All right, so anyways, can you reabsorb atherosclerotic plaque? Yes, you can to a certain extent. You can reabsorb the soft parts, the acute clot, the lipid core of the fat in there, the necrotic core of dead cells. That can all be reabsorbed and shrink down the plaque. So if you catch a plaque early, you can reverse it completely. Okay, but once you have acellular fibrous tissue, you're not going to reverse that. You probably can't reverse your calcification. A couple people tell me, oh, but vitamin K2 with vitamin D3 can absorb the calcium. Maybe. I've never seen it in a real patient, and I looked at a couple papers that said it can't do it. So maybe somebody else is claiming, and maybe someday they will, but for our intents and purposes, probably not at this point. As soon as you start eating a healthier diet, within a couple of days, you'll start making more nitric oxide through your endothelial cells. These are your endothelial cells. Endothelial precursor cells circulating in the blood become endothelial cells. They cover up the plaques. Anyways, they'll reestablish their nitric oxide production. The artery will vasodilate just from that. So you'll get an improvement within a couple of days typically. Okay, so yes, you can make a giant improvement in the clinical situation. Oh, another thing, I put this picture in here because I can tell you, most people, including most doctors, that even remotely consider going vegan, most of them outright refuse it. I'd rather die than stop eating meat. Yeah, that's what's going to happen to you. But then they say, oh, I have no time to read. And I'm like, BS. I'm a full-time clinical doctor. I very often get home at 6:30 or later. I still can manage to write 20 books and make a couple videos every night. So what I'm trying to say is, put a table in your bathroom. I call this the magic bathroom. I use this when I was taking my boards. I crushed all my boards exams. And so you just slide it over with your foot, and you could read. When you're doing a number 2, read a bigger book. When you're doing a number 1, read a smaller book. You're going to go into that bathroom. I counted it. I go in the bathroom like 20 times a day or more. So just make sure you always read at least one page. You'll be amazed at how many books you read. When you're in the car, don't be listening to music like a moron. Be listening to an audio book or some type of audio book or audio CD book, or listen to it off your cell phone. But you can always be learning, okay? Yeah, my wife did not allow anybody, my ex-wife now, she didn't allow anybody to see this bathroom if she wanted to impress them with our house. And you can guess why. I was sequestered into the basement. I was the thing that lived in the basement. So anyways, that's the end of what I got for you today. I hope that was helpful. And basically, you're on your own, but if you know what to do, you'll probably do quite well.